alternative option to implant breast augmentation is to use the patient's own fat. This technique is known as fat transfer or lipomodeling. Using liposuction technique, where fats are harvested from some area like the abdomen, inner thigh, or the flank area. These fats will then be collected in a container, washed and cleaned, and after the excess fluid has been removed, the fat can then be injected into the breast. Obviously, some of these fats that are injected will reabsorb, but once the fat itself regains its blood supply from the local tissue, it will become permanent. It will behave like normal fatty tissues with the breast volume increment, and it will change with weight, hormonal changes, and aging. We do not recommend excessive injections per sitting simply because it most likely will increase the reabsorption rate rather than the amount of fat that will survive. Therefore, if you're thinking of a large breast augmentations, a breast implant will still probably work slightly better. So you may want to ask me, why use fat transfer when you can have a bigger increment using a breast implant? Well, the two things are that using fat transfer is permanent. Secondly, you do not have to undergo another surgery to remove the old implant and replace with a new one. Currently, there are 3 groups of patients that are suitable and would like to use the fat transfer technique. The first groups are those that dislike the idea of having an implant and have excess fatty tissues that they would like to use for the breast augmentations. The second groups are those that have an implant in them and would simply like them removed. However, they would not like to go back to the original size and would still like to have some volume. The fat that we use can increase the volume without having the implant. And the final groups are those that currently have an implant but would like to have a smaller implant. By using fat transfer, it will increase the coverage of the implant, making the feel of the breast better and also improve the contouring, like the upper pole fullness or the medial cleavage area. So what's the downside of having fat transfer? Well, obviously, because of the harvesting of the fat, the duration of the operation will be slightly longer. From the site of where we harvest the fat, it will have some bruising, swelling, and you will have a little bit more discomfort at the first week of the surgery. But with the use of painkiller and garment, they will soon disappear. After the fats are injected into the breast, as we have said earlier, some will get reabsorbed. So on some patients, you may require a second operation for some top-up of extra fat to improve the contour or symmetry. Some patients may get a period of slight discomfort or some hardening due to the internal scarring or some of the fatty lump. Some people may develop small little oil cysts that feels like pee, but in general, most of these conditions will improve with time. So in conclusion, both implants and fat augmentations have their place and will suit different group of patients. As a patient, it is important to have a good discussions with your plastic surgeon about the different options, your personal preference, and what you would like to achieve.